ऊपर ये साइड पे की शिफ्ट हो सकती है। Do we have a system whereby I can see कि जो इस वक्त ऑनलाइन है वो कौन है लोग? जी सर, तो जरा एक दफा दिखा दें मुझे।
तो ये पार्टिसिपेंट्स के नाम आ रहे हैं।
ये कहाँ पे हैं तो? ये ऑनलाइन है?
ये ऑनलाइन है जी।
डॉक्टर नाज नाब ये कितने हैं इस वक्त?
सर इस वक्त 35 पार्टिसिपेंट्स हैं टोटल, यहाँ पे ये लिखे आ रहे हैं जी।
ये ऑनलाइन हमें सुन रहे हैं?
जी सर।
ओके
सर, हम आपको देख भी रहे हैं।
आप थैंक यू सो मच। आप बता दें आप कौन हैं?
सर, आई एम डॉक्टर नवीन फ्रॉम मुल्तान।
Thank you for being online with us, or you are welcome.
Thank you, sir.
चलें जी, ये साहब द Khurshid please the screen के आगे से डालें। चलें जी बताइए।
The thyroid gland controls the rate of metabolic process throughout the body via the production of two hormones, T3 and T4. These hormones play the key role in the growth and development, especially the brain development. Thyroid hormone release is under the control of hypothalamus and anterior pituitary. Thyroid gland in pregnancy increases in size by 10% during pregnancy in iodine deplete countries and 20 to 40% in iodine deficient countries. Production of T3 and T4 increases by 50% during pregnancy. Daily iodine requirement increases by 50% during pregnancy. 10 to 20% of all the pregnant women in the first trimester of the pregnancy are thyroid peroxidase or thyroglobin antibodies positive and euthyroid. TSH under the impact of HCG is decreased throughout the pregnancy.
Okay, can we stop here for a while?
Yes,
I think instead of going back at the end of the presentation, if we have any query or question, or is there if any, should we do it side by side or at the end of the presentation?
So whatever you want.
So how long are you going to take for the completion of the presentation? 10 slides, maybe 10 minutes?
Yes, yes.
Okay. So we will discuss at the end of the presentation.
Hypothyroidism pregnancy. 2 to 3% of the apparently healthy non-pregnant women of the childbearing age have elevated serum TSH, and an estimated of 2.3 to 2.5 would have overt hypothyroidism, and 2 to 2.5 would have subclinical hypothyroidism. Prevalence is higher in the areas of iodine deficiency. Mechanism of hypothyroidism includes physiological changes of pregnancy, including the increased level of thyroxine binding globulin in response to the estrogen stimulation, coupled with the reduced clearance of thyroxine binding globulin and increased glomerular filtration rate, increasing the clearance of free thyroid hormones, resulting in the reduction in the circulating levels of free thyroid hormones. What are the symptoms of hypothyroidism? Includes lethargy, sleepy, cold intolerance, weight gain, constipation, menorrhagia, decreased memory, and hoarseness of voice. Next are the signs of hypothyroidism, which include ataxia, dry skin or hair, cold hands, ascites, non-pitting edema, puffy face and lids, yawning, drowsy, slow reflexes, immobile or ileus. Here are the causes of the hypothyroidism, which are divided in further 3 types: primary hypothyroidism, secondary hypothyroidism, and tertiary hypothyroidism. Causes of the primary hypothyroidism include autoimmune diseases, iatrogenic, transient, and iodine deficiency, which are further divided into the atrophic thyroiditis, Hashimoto thyroiditis, radioiodine therapy, thyroidectomy, anti-thyroid drugs, and transient includes subacute thyroiditis and postpartum thyroiditis. And the causes of the secondary hypothyroidism include pituitary tumor, pituitary failure, and in case of tertiary hypothyroidism, there is hypothalamic failure. Here are the complications of the hypothyroidism in pregnancy, which are divided into the maternal complications and neonatal complications. Maternal complications include anemia, postpartum hemorrhage, cardiac dysfunction, preeclampsia, and placental abruption. And neonatal complications include fetal distress in labor, prematurity or low birth weight, congenital malformations, perinatal death, stillbirth, neurodevelopmental delay, or congenital hypothyroidism if autoimmune disease. Screening for the thyroid disease in pregnancy includes family history of thyroid disease, goiter, positive thyroid autoantibodies, clinical signs or symptoms of the hypothyroidism, diabetes type 1, history of miscarriage or preterm delivery, history of thyroid dysfunction or thyroid surgery, history of subfertility, history of therapeutic head or neck irradiation, age greater than 30 years, and previous treatment with amiodarone or lithium, recent exposure to the iodinated radiological contrast agents. How can we diagnose the hypothyroidism? In hypothyroidism, there is always elevated TSH and reduced T4 concentration. Here is a criteria. If TSH is greater than 2.5 with decreased T4 concentration, TSH greater than 10 with decreased T4 concentration. In subclinical hypothyroidism, TSH is between 2.5 and 10 with normal T4. Treatment of the hypothyroidism includes levothyroxine. Here's the aim to normalize the TSH values within the trimester-specific pregnancy reference range. In the first trimester, normal value is 0.1 to 2.5. In second trimester, 0.2 to 0.3, and in third trimester, 0.3 to 3. Levothyroxine dose requires the adjustment due to increased demand as pregnancy progresses. In women with previously diagnosed overt or subclinical hypothyroidism, taking levothyroxine before pregnancy, the dose should be increased initially by 25 microgram daily once pregnancy is confirmed to compensate for the increased T4 demand of the pregnancy. Thyroid function should be monitored every 4 to 6 weeks, and further increase in the levothyroxine dose may be required to maintain the optimal range of serum TSH. If a patient is hypothyroid before pregnancy and receiving levothyroxine who are planning pregnancy should have the dose adjusted in order to optimize the serum TSH values to greater than 2.5. 25 to 30% increase of daily levothyroxine dose is required. Thank you.
Good. Serenji, first of all, I would like to introduce the lecturer.
So Dr. Aisha, we just got late from the meeting. We were on duty today and we just got
Okay. Question I free.
Dr. Sarah.
Dr. Sarah.
So I was in
That bro? Yeah. There not enough a proper arrangement for you to be here on time when you're supposed to be here at 8:30?
We were told to inform the room so we were there and
Who organizes this thing of being on? Suppose you are on duty in the labor room and now you are on duty in the classroom. This is what I understand. Am I right? So who is responsible for this change of duty from point A to point B?
any senior.
Who is that senior? See? साइजदार डॉक्टर आए, तो वो हैं यहाँ पे से? तो आपने 8:28 पे उन्हें बताया कि मैंने 8:30 पे वहां पहुंचना है, फिर उन्होंने क्या कहा? आप दोनों का भी ये रीजन? और इधर कौन आप आए पर बिफोर वी स्टार्टेड बट आफ्टर 8:30?
जी सर 8:32 या 3.
जी, थैंक यू फॉर बी नॉट टुडे. I am rubbing it hard. Okay, this is something which happens. We are in the middle of something and invokes a person, which causes a distraction to everyone. दो तरीके, या तो when we start the presentation at any fixed time, 8:30, 31, 32, 33, and we stop it. Or we let it happen and let it happen throughout our lives to be late and to continue that vicious circle of being late and late. And then that becomes a habit. What we do, we attain perfection in things that we do again and again. If we do things in the right way, again and again and again, you become a champion of that. वो जो आपने देखे ना बिलियर्ड खेलते हैं, they keep hitting again and again and again. कैरम बोर्ड खेलते हैं, वो बंटे खेलते हैं, they keep doing it again and again and again and again and keep doing it the right way, and then they become champions. So if you want to do something in life, you have to try to achieve that perfection again and again and again, and only then it will become a habit. That's your choice. I am only trying to emphasize this point. आप कहीं पहुंचे वक्त पे ना पहुंचे, उससे मेरी लाइफ में कोई फर्क नहीं पड़ता. फर्क इस बात से पड़ता है आपको कि आपने दिन में एक दफा या दो दफा कहीं पे वक्त पे पहुंचना है, एक दफा या दो दफा वक्त पे पहुंचना है, पर दिन सारा आपने को 70 काम करने हैं. You have to do so many things every day. For example, you have to write down the PV findings every day so many times. So if you have a format that you have to write A, B, C, D, E, F, G of any pelvic examination finding, you have to see the consistency of the cervix, the dilatation, the station, the membranes, the liquor, the position of the head, whatever. You have to mention all those things on the chart. But if you keep skipping a couple of these things, okay, कोई बात नहीं, अभी तो ऐसे ही है, अभी मैं यही लिख देता. So then that will not become the habit of completing things will never be attained. Reaching somewhere on time maybe is important once or twice each day. इससे ज़्यादा हमने वक्त तक नहीं पहुंचना नहीं होता है every day. 3 दफा 5 दफा. The rest of the work that is to be perfected as a habit. What are your questions now on this presentation? Just go to the first slide. G. Does it raise any queries in your mind? I am concerned about this fourth bullet point, TGAB.
Thyroglobin antibodies.
Thyroglobin antibody. What is this thyroglobin? What is this thyroglobin?
Sir, thyroglobulin is a protein which carries the thyroid hormone.
Thyroglobin is a what?
Thyroglobulin is a protein.
It is a protein. And where is
Yes,
it
sir.
located?
Sir, it is located in the thyroid gland.
In the thyroid gland. What is the unit of the thyroid gland? The unit is a thyroid follicle, which is a small follicle which contains this fluid, and it has thyroglobin, and it is lined by cuboidal cells. This is one of the few sites in the body where you have the cuboidal cells lining the follicles. What else? Can you, Zainab, guide us to how are these thyroid glands produced? Can you tell us in briefly?
Sir, thyroid releasing hormone is produced from the hypothalamus,
Okay.
which acts on the anterior pituitary and produces a thyroid hormone, which acts on the thyroid.
No, it doesn't produce the thyroid hormone. Thyroid hormone, I imagine, is produced by the thyroid gland.
Ji sir. Thyroid stimulating hormone produced.
TSH, thyroid
sir.
stimulating hormone is produced by the anterior.
And
Okay.
which acts on the thyroid gland and releases T3 and T4.
From how is it produced by the thyroid gland?
Um, um,
From what? What are the precursors of the thyroid, of thyroxine, T3, T4?
the thyroid peroxidase.
Is the enzyme.
Yes, sir.
All right.
Thyroid binding globulins.
Okay. It is produced from iodine and tyrosine,
Yes, sir.
which is this combination is
Triiodotyrone.
ironine,
Thyronine. Sorry.
triiodotyrosine, triiodotyrosine, and then triiodothyronine and thyroxine.
Thyroxine.
These are the hormones you have, and the most active amongst these is the T3, right?
Yes, sir.
Okay. So this is the logical aspect of the synthesis of the hormone, and it is produced in the thyroid follicle. Okay. Anything else next? And now you can see that the daily thyroid requirement is increased by 50%. So normally, if somebody is taking thyroxine, how much? If somebody is deficient, What would be the requirement?
25 to 30.
25 to 30
So
what?
micrograms.
Micrograms.
Yes, yes.
And then if it is increased, you can give her up to
50.
1 tablet of thyroxine,
Yes, sir.
or there is the product of thyronome,
Yes,
which
sir.
is 75 micrograms.
Yes, sir.
And when do you give it to the patient? At what time should the patient take thyroxine? I am asking, you should tell me. In the morning.
Morning. Morning empty.
What time? Before breakfast, empty stomach.
Before breakfast.
Right, before she takes anything else. All right. Next, please. आपको कोई questions नहीं है? You have no queries to anything?
सर थायराइड रिप्लेट का मकसद क्या होता है?
Sorry, say that again.
थायराइड जो इस स्लाइड में लिखा था ना, थायराइड रिप्लेट एक डेफिशिएंट था.
बताएं जरा, what do you mean by this first line? Pregnancy increased by 10% in pregnancy in iodine deplete countries and 20 to 40% in iodine deficient countries. तो आपको इस लाइन से मतलब तो खुद it is self explanatory कि एक तरफ तो है deficiency in places, for example हमारे जो northern areas हैं, in northern areas of Pakistan there is deficiency of iodine in the water naturally. So that is why we have preparations which is called iodine fortified salt, iodine मिला नमक, तो वो भी एक है. और in replete means जो के भरा हुआ है, complete है, और जहां पे पूरा है आयोडीन का काम, राइट? जहां पे आयोडीन मिलती है डाइट में, पानी में, फूड में, replete countries or places, whereas compared to which is iodine deficient. Is that clear?
थैंक यू सर, थैंक यू.
चलिए जी आगे चलें. Prevalence is higher in areas of iodine insufficiency. It's the same thing.
सर
वालेकुम सलाम.
सर थायराइड फंक्शन टेस्ट जो है वो हम मतलब कब करवाएंगे, इंडिकेशन कब बनती है? एवरी प्रेग्नेंट पेशेंट को तो हम नहीं करवाएंगे, या कोई इसके फिक्स वीक है कि हम देखें उसके हिसाब से?
तो क्यों नहीं करवाएंगे आप? मुझे पहले ये बात बता दें.
सर हम रूटीन में हर प्रेग्नेंट पेशेंट को करवाते नहीं हैं TSH वगैरह,
क्यों नहीं करवाते?
क्लिनिकली देख के सर.
Good. This is what I wanted you to say. आगे जाके डॉक्टर जैनब ने बताया आपको कि क्लिनिकल सिम्टम्स क्या हैं, साइंस क्या हैं, क्लिनिकली वो सस्पिशन रेज होती है ऑफ hypothyroidism or not. So if you have all those things, for example, in a patient who is not conceiving, who has infertility, the workup of that patient would include thyroid function tests. But once there is no unexplained infertility in somebody and she is just pregnant, then you have to look for the clinical features only, the symptoms and signs, and then if you suspect, then you can get those done.
जी सर ठीक.
Next, please.
सर अगर ये मतलब आ जाता है पहले में कि थोड़े से डिक्रीज है, फिर बाद में सिर्फ आयोडीन देने से अगर वो नॉर्मल फंक्शन आ रहे हैं तो फिर हम थायरॉक्सिन ऐड नहीं करेंगे उसको?
How long would it take for that thing to happen? पहले आप आयोडीन उसके बिल्डअप करेंगे, फिर देंगे, फिर आप ट्राई करेंगे. वो तो है लॉन्ग टर्म उसकी, अगर आयोडीन डेफिशिएंसी सस्पेक्ट हो रही है. बट फॉर as any suspicion, I would go for the test straight away and replace if required. There's some background disturbance in somebody's household affairs.
Dr. Farzana.
Okay, next please. So these are the symptoms of hypothyroidism.
सर अगर हम फर्स्ट ट्राइमेस्टर में उसको थायरोनॉन स्टार्ट करवा रहे हैं तो फिर हम उसमें कितने वीक्स के बाद रिपीट करवा के देखते रहेंगे या बस वो टैबलेट जो हम 25 से लेके 30 माइक्रोग्राम तक दे रहे हैं बस वही चलती रहे या हम उसको मतलब देखेंगे कि क्या वाकई वो उसका नॉर्मल कंसंट्रेशन आ रही है या बस उसको कंटिन्यू करेंगे?
If initially you adjust the desired dose, you can get it repeated in after about 15 days, right? Because the life of thyroxine is about up to 14 days. So you can get it checked after 2 weeks and then maintain it on a 2 monthly or a 3 monthly test.
जी सर क्योंकि वो कंटिन्यूअसली उसकी डिमांड तो इंक्रीज होती रहती है तो
उस
इसलिए
हिसाब से आप उसी रेशो से उसी हिसाब से आप उसको ग्रेजुअली स्टेप अप करते जाएं. So what, just like you step up the dose of insulin as the pregnancy advances, or if there is any period of stress in a pregnancy, like infection, or if you have to add at 32 weeks some dexamethasone injection, you step up the dose by 30%. So here you know that the demand increases by up to 25 to 50%. So you keep stepping up the dose.
50% sir.
जी?
Then sir 50% हम डोज इंक्रीज करेंगे.
डिमांड जो है वो इतनी बढ़ रही है ना.
जी जी सर.
उतना इंक्रीज कर देंगे.
जी सर, थैंक यू.
And you obviously you titrate it with the serum levels of thyroxine and TSH.
जी जी.
इस तरह से हम स्टेप अप करेंगे अकॉर्डिंग टू
Well, if the thyroxine, the level of TSH जो जब बताई थी इन्होंने 2.5 to 10 उसके बीच में है. Maintain it at normal TSH level is 0.4 to 4. So if you want to keep it at 3 or something, around 3, so that is good enough. अगर वो TSH level 3 पे आ रही है, तो ठीक है, because then that means the negative feedback of thyroxine is good enough to not to allow the hypothalamus and the pituitary to release higher levels of thyroid stimulating hormone. Thyroid gland work more. So that is enough feedback. So maintain it around 3, 2.5, 3, 4, not more than that I would suggest, because that is the normal level. Okay?
Second trimester में 0.2 to 3. हाँ.
नहीं दिखाओ ना, इसको पहले क्लैरिफाई करो कि ये क्या है. राइट देयर.
पॉइंट 2 to 3 है. वो 0.3 नहीं.
नहीं पर ये TSH की लेवल जो हैं प्रेगनेंसी में हायर होती हैं लोअर होती हैं.
TSH की लेवल्स में प्रेगनेंसी में हायर होती हैं.
तो ये तो लोअर है जो आपने लिखी हुई. This is lower than the normal levels. Normal level 0.4 to 4 होती है, मुझे ये पता है. aim to normalize TSH values within the trimester specific pregnancy reference range. First trimester में आप कह रहे हैं 0.1 to 2, 0.1 to 2.5 makes sense. Second trimester, third trimester, 3 makes sense.
So second में भी 0.2 to 3 है, 0.3 नहीं है.
हाँ, 0.3 नहीं है. That is
Yes,
a
sir.
mistake.
Yes, sir.
So you have to point out
Yes, sir.
that this figure is an error.
Yes, sir.
This should be 3, not
sir.
0.3. This is for everybody to note
Yes, sir.
that this 0.3 is a mistake.
Yes, sir.
चलें जी आगे.
सर प्रेजेंटेशन इज नाइसली समराइज्ड, पर इसमें सर कौन से रेफरेंसेस यूज किए गए हैं, कौन से गाइडलाइन, मतलब जो भी रेफरेंस हो वो आप नीचे या शुरुआत में जो है ना ऐड कर दे तो ज्यादा बेहतर होगा.
Has it necessarily be from some guideline? Could it be from textbook? It could be from any source of knowledge. And if somebody has read it from a different source, you can discuss that you have read it or you have gained knowledge in a different manner, or what you have seen here is inappropriate, incorrect, something different, or whatever it may be. The point is that we need not necessarily quote the books, or because what I may be speaking, I remember it only from it is only from my memory that I am talking. I can't quote a book right now. Similarly, if the speaker can quote a book, it's fine, but I don't think it is absolutely essential, because a single presentation may be from many sources. But there's no harm in sharing the sources. If it's a good source, you can share the source of that knowledge with your colleague.
So RCOG guidelines 2015.
So 2015 RCOG guidelines, fine.
जी सर, यू आर वेरी राइट. पर सर अगर ये डिस्कस जैसे अभी उन्होंने बताया आरसीओजी, तो हम लोग जैसे ऑप्स एंड गायनिक हैं तो फिर आरसीओजी पे हमारे थोड़े ना कान खड़े हो जाते हैं, तो उस हिसाब से हमारे लिए बेहतर है कि अगर इन्फॉर्म
ठीक
कर
है,
दिया.
but I would say that this is this is not something new. आपको RCOG guidelines भी पता है, आपको वो नाइस भी पता है, आपको मैराथन कॉलेज का भी पता है, ये सारी चीजें तो हैं यहाँ पे मौजूद हैं, और you know all these sources. There's nothing new about these things. Okay, what next? Anything else? Next, please. Age greater than 30 years. What happens after 30 years? जी, मैडम. Why? Why? This is a screening factor. Does that mean it is only related for pregnancy or for anybody?
For anybody.
Anybody.
Yes,
That
sir.
means when we go past 30, we should have a thyroid function test. Is that so?
Yes, sir. So नहीं, लेकिन वही clinically अगर sign and symptoms वगैरह.
Okay. So if there are some clinical signs and symptoms, then we can go for this screening. All right. Like I was mentioning, history of subfertility,
Yes,
history
sir.
of therapeutic radiation. All right. What is amiodarone? Amiodarone, lithium. What is it used for? Psychological conditions, psychiatric conditions? Mood psychiatric conditions, right? And similarly, amiodarone, this is for the same purpose. Janet, what is this used, or is it the same thing? I think they're different things.
Also, the kind of Lodhi structure. It's the coupling of enzymes.
But why is it previous treatment? Why do we treat people with amiodarone?
Sir, it's an antiarrhythmic drug.
Antiarrhythmic drug. Okay, fine. Used in cardiology, right? Next, please. PSH more than 10, right? PSH less than. So if you see a test, patient के पास report है, या talks में आपके आ जाता है कि ये thyroid function test पे comment करें. The patient is pregnant, and the report is, आप उसको जो test की report होती है ना हमेशा, whenever you see a test report, immediately think about the talk station. कि ये अब आपका talk station शुरू हो गया, इस पे ये report है. आप क्या इसको interpret करेंगे? How do you interpret? For example, if I say that there is a TSH report of 12 million international units per liter, and the T4 level is
Normal.
normal क्या होती है? T4 level normal कितनी होती है? T4 level कितनी होती है? 3 to 10?
Yes, sir.
पता होनी चाहिए अगर आप इंटरप्रेट करना है इसको
Yes, sir.
with T4 तो नॉर्मल लेवल्स पता होनी
5 to 12.
5 to 12 ओके 5 to 12 तो अगर वो 3 आ रही है और TSH लेवल 12 आ रही है इसका क्या मतलब है? Hypothyroid. Next, please. When you put somebody on thyroxine in pregnancy, let's say at 16 weeks, it has been diagnosed, and you start or prescribe thyroxine for a patient. What instructions will you give to the patient at that point of pregnancy?
With applications on.
So you want to warn her about the side effects, okay? Or all right.
Or just repeat करानी पड़ेगी. Like 1 month up to 1 month and 2 months.
All right.
Fetal monitoring साथ-साथ करवाएं.
What does that mean, fetal monitoring? आप उसे कहेंगे fetal monitoring करवा लें. What does that mean? How?
Regular ultrasound.
How will you monitor the fetus?
Ultrasound करवाएं.
What is regular? The regularity. Yeah?
After a month.
After a month? You talk about pregnancy in months?
So weeks.
Weeks. So you will call her back at अच्छा अगर आप कह रही हैं 4 weeks तो मैं मान लेता हूँ आपने कहा to monitor her pregnancy regularly. Regularly is 4 weeks. So 16 weeks पे आपने बताया और आपने 20 पे बुला लिया उसको. अब आगे क्या करेंगे आप? I don't know. 20 पे होगा ना anomaly scan.
22 weeks पे सर.
Generally 22 पे 24 पे करते हैं. 18 पे नहीं करते या 20 पे नहीं करते generally. After 20 करते हैं. तो वो तो एक anomaly scan रूटीन में वैसे ही होना है. थायराइड डिजीज के लिए क्या करेंगे?
जब एडवांस हो जाएगी प्रेगनेंसी तो सीपीजीज करा लेंगे.
देखिए आप बी स्पेसिफिक, बी पर्टिनेंट. 16 वीक्स पे मैंने आपसे सवाल पूछा कि 16 वीक्स पे आपने थायरोक्सिन प्रिस्क्राइब कर दी. व्हाट इंस्ट्रक्शंस विल अकम्पनी दैट प्रिस्क्रिप्शन? आपने कहा रेगुलर मॉनिटरिंग करेंगे और राइट टीएसएच और उससे कर लेंगे आप थायरोक्सिन लेवल. पीटर मॉनिटरिंग करेंगे आप रेगुलरली. आपने कहा 4 वीक्स. और आपने क्या कहा? अल्ट्रासाउंड स्कैन कर लेंगे और
साइड इफेक्ट्स है बताएंगे.
साइड इफेक्ट्स का बॉन्ड करेंगे. ऑलराइट.
डोज एडजस्टमेंट का बताएंगे.
डोज एडजस्टमेंट का बताएंगे. और आपने ये भी कहा कि उसे कहेंगे कि रेगुलरली लेती रहे, बंद ना करे. क्योंकि एक टेंडेंसी, there is a tendency amongst our patients that when they feel normal, they give up the therapy.
Yes, sir.
They don't comply with the prescription. Compliance खत्म हो जाती है. What else?
तो जो पहले बात की थी कि बिफोर ब्रेकफास्ट.
Thank you very much.
Once a day.
Before breakfast, empty stomach in the morning, at least half hour before taking anything, you have to say that again and again and again.
Yes,
and when she comes back, you have to ask again and again,
whether she's
when do you take it? How do you take it?
Yes, sir.
रात को सराहने रख के सोए ग्लास पानी के साथ. 2 घूंट पानी के पी के साथ गोली खाए. रोजाना खाए, वक्त पे खाए, उसी वक्त पे खाए, सुबह ही खाए.
Yes, sir.
रात को नहीं. अच्छा जी. What happens if she misses a dose? What happens if she forgets to take it on a particular day? इतनी सिंपल बातें आप सोचते ही नहीं हो.
सर
एक डोज मिस करने से कुछ फर्क ज्यादा नहीं पड़ेगा.
जी
एक डोज मिस करने से ज्यादा फर्क नहीं पड़ेगा.
नहीं पड़ेगा. ऑलराइट. तो फिर क्या करना चाहिए?
लेकिन जो पीक है या जो अचीव करना चाह रहे हैं
जी
तो जो पीक लेवल अचीव करना चाह रहे हैं वो अफेक्ट होगी.
वो अफेक्ट हो जाएगी. तो वो भूल गई तो भूल गई, कोई बात नहीं. ठीक है. उसे कहीं आंदा याद रखे और अगले दिन से फिर वो लेती रहा करे या कुछ करे इसको. ठीक है. उसका अलार्म लगा लिया करे, भूले ना.
मॉर्निंग भूल जाए तो
ले ले बाद में, ले ले बाद में, जाए हो जाएगी ना मैक्सिमम. और कितने की आती है ये? इट्स अ वेरी एक्सपेंसिव ड्रग. हेलो everybody online, do you know the cost of this drug, thyroxine? Are you there? Everybody there online?
Yes, sir.
We are listening. I
But
think
Sir, it's 300 to 350.
300 to 315 for how many tablets?
Sir, per 100 tablets.
So it is not a very expensive drug. The best thing about thyroxine is 2-3 रुपए की गोली है. It's a cheap drug. It is available, freely available, and compliance. The cost is not a factor in the compliance of this treatment. It is a relatively cheap drug. At times, it may be deficient in the market, but otherwise it is cheap and it is all the times available. Most of the time. Next, please.
नेक्स्ट क्लास डॉक्टर आशीष की और वो ऑनलाइन आ गए।
वो ऑनलाइन आ गए। ओके, थैंक यू वेरी मच। सर को ऑनलाइन कर दें तो फिर सलाम करके तो फिर मैं खुदा हाफिज कर देते हैं।
जी सर, उनको लाइव ले लेते हैं।
सर की क्लास में
सर एक बार वो स्लाइड तो रिपीट कर दें जिसमें फीटल कॉम्प्लिकेशंस लिखी थी।
ओके, बाद में आपसे शेयर कर लेंगे वो, राइट?
स्लाइड शेयर हो जाएगी बाद में।
Assalamu alaikum, sir.
वालेकुम अस्सलाम।
Sir, I have a question.
जी
सर ये हमने 25 माइक्रोग्राम हर पेशेंट में इंक्रीज करनी है थायरोक्सिन की जब भी पेशेंट कोई प्रेग्नेंट होगी हाइपोथायराइडिज्म के साथ इन एवरी पेशेंट।
व्हाट एवरी पेशेंट व्हाट?
सर 25 माइक्रोग्राम हमने थायरोक्सिन इंक्रीज करनी है।
जी, obviously,
पहले वो डोज
as the metabolism goes